One of the most significant landmarks in the history of healthcare was perhaps the electronic medical records, which was a step in the direction of patient-centered care. And with its history of over 30 years of digitally collecting patient encounters, prescriptions, document management, clinical decisions, EMR has proved that it has improved internal processes for healthcare. In 2019, the concept of EMR has expanded much more to include more patient-related data, such as daily heart rate, which can be collected from various devices known as the Internet of Medical Things. In this video, I will introduce the concept of IoMT, or the Internet of Medical Things, and then I'll give you an example of an Internet of Medical Things device, and then we will discuss how these personal data collectors are contributing to a more patient-centered healthcare. To start, IoMT is defined as a collection of medical devices and applications that connect to the healthcare IT system via computer networks. These devices also feed in the information to the patient's EMR. With IoMT, we have access to wearable and internet-connected sensor and monitoring devices that can collect a range of information from the patient, such as heart rate, blood oxygen saturation, blood pressure, or even blood glucose levels. Now, these information can be fed directly into the EMR and it can be collected real time. This can also be shared with a doctor who is remotely monitoring the patient from a different location. This whole system allows for an in-depth analysis of the patient's records, which is another step in the direction of patient-centered care. Take, for example, a LifeCore that offers an ECG system that can be used by patients remotely. And this data can be used by their physicians to get an in-depth analysis of their heart health. IoMT devices often encourage a better patient-to-provide engagement. The data collected from these wearable devices are often digitally presented to the patients in an easy-to-understand manner, which makes them feel empowered to discuss their health status with their providers. Now, the providers or the physicians can now also check whether the patients are adhering to their healthcare regime. This whole system of the patients being encouraged to take care of their health and the providers being able to monitor what their patients are doing practically provides a more detailed direction to patient-centered care. Using IoMT for patient-centered healthcare have caught the attention of both private and public healthcare systems. Find out how Memorial Sloan Kettering has been achieving patient centricity in their healthcare system by following the link in the description. Thank you.